We're going to talk about if you have pain with weight bearing and you put weight through it and it hurts. It's very distinct. Weight bearing increases pain. Now, this is the one I referred to before, piggybacking with the exercise where you do the pendulum and swing while standing on a step. These two can work together very well. What you're going to need to do is something you do not want to do, or most people don't want to do, and that's simply use a cane. People just don't feel comfortable sitting with a cane. You just have to get over it. So what you'll do is take a cane. Hopefully you have one you can test with. Make sure it's the right height when you're standing tall. Let this arm down. The crease of the wrist should line up with the handle, plus or minus a little bit. It's not very exact, but pretty close to that. My right hip is sore. The cane is going to be in the opposite hand. Okay, it works better with that way. Just trust me. So when the right leg goes forward, the cane goes with it. I'm putting weight through this side, unloading the hip, and stepping through. So the cane and the sore leg work together in unison. They can make a big difference. I've had people say, I'm not using a cane. I say, just give it a try. Here we are in the clinic, see how it goes. And they'll use it, and it's like, oh, pain goes from a 10 down to a 3. They decide the cane's a pretty good idea.
You're going to pick which one feels best for you. We're just going to go through a bunch of different hip motions. If one area is painful, avoid that. Do which ones feel good for your hip issues. To begin, I'm going to stretch my left leg. We're saying this is my good leg first, then go to the bad leg to see the discrepancies. So first, you're just going to start with the knee to chest like this. You can become straight up, or you can go slightly out to the side. My anatomical build, I can actually go higher out to the side. Just do what feels good for you. After this, try bringing across your body. See if you feel a good stretch here. Notice the rest of my body is still facing up. I'm not falling over. You can hold this. If this feels good, it's a good outer hip stretch. You can also try bending your opposite leg, and this is called a figure 4. So what I'm doing is ankle is touching this knee, and then you try to bring this down here. Stretch like this. This is a good option. This may be all you need to do. If you want to get a little more fancy with this one, you could certainly grab the opposite leg and pull up. If this is uncomfortable, do not worry about that. But just go which motion in the hip feels the best and stretch that out. Then go to the...
Wait, Mike, I want to add one more.
One more?
Yep, go back down. For those of you who cannot do that figure 4 he mentioned, you can actually do it with this leg down, and that's a little bit less aggressive. Particularly older people, I think, may respond better to this.